What is quadrilateral precise lengthening? Quadrilateral precise lengthening is a surgical procedure that lengthens both the femurs and tibias in the legs, allowing for greater overall height gain. This advanced procedure utilizes magnetic-controlled intramedullary nails, which are inserted into the bone to safely and precisely extend the legs over time. How does quadrilateral precise lengthening work? The procedure involves implanting precise nails into the femur and tibia bones. These nails are lengthened gradually by a magnetic external remote controller, stimulating controlled bone growth and allowing the bones to extend. This slow process promotes proper healing and minimizes risks. How to lengthen with quadrilateral precise? After surgery, the lengthening process is activated through an external magnetic device, which is used daily to gradually extend the nails inside the bones. Patients follow a schedule for lengthening, typically around 1 millimeter per day, to ensure safe growth without overextending.
When you activate the magnet, it takes about 2 minutes, 0.33 millimeters, and it's loud. Okay, if you ever have an MRI, it's loud, so you want to do it and then just pause it after.
Do you feel anything?
I don't feel anything. So I'm going to pause it. And then I can just resume it here, and it has everything in terms of the measurements. So you don't feel anything during the actual lengthening process. And I mean, that's pretty much it. It's just, it's very simple.
That's all.
That's it. It's very simple.
Once it's in the position, you press F1, it starts. You don't feel any pain in this part. There is no pain, but maybe after lengthening you will feel some pain. So you have to do stretching, and you have to walk around 5 minutes after every lengthening. It's so important for the bone healing and for the tissues and tendons.
How much taller can I grow with quadrilateral precise lengthening surgery? With quadrilateral precise lengthening, because there is a limit with the precise nails, patients can gain up to 8 centimeters per bone segment, resulting in a potential total of 15 to 16 centimeters overall. The amount of height gain depends on individual conditions and the surgeon's guidance for a safe lengthening process. What is the role of physiotherapy in quadrilateral precise lengthening? Physiotherapy is essential throughout the lengthening and recovery process. It helps maintain muscle strength, joint mobility, and overall flexibility. Stretching exercises are crucial to support soft tissue growth and to prevent stiffness during the lengthening period. Because there is no external fixators, patients can also use Alter-G during the process. During the treatment phase, you can begin sprinting using a special treadmill that reduces your body weight by 80%. Allowing you to only bear 20% of your weight. This unique feature strengthens your muscles, enabling training of all muscle groups while improving blood circulation, which promotes faster bone growth. Thanks to this technology, the healing process can be accelerated by 3 to 4 times compared to conventional methods. Nail exchanging after lengthening finished. Once the desired length has been achieved, the precise nails, which are not weight-bearing, must be exchanged for trauma nails. This allows the patient to walk with full weight bearing. The exchange ensures stability for the healing bone, maintains proper alignment, and allows for a full recovery without complications. Recovery process. The recovery process after lengthening involves physical therapy, regular follow-ups with your surgeon, and a gradual return to normal activities. Bone healing typically takes several months, and patients must avoid high-impact activities until fully healed. Scars of quadrilateral precise. Lengthening scarring from the surgery is generally minimal, as the incisions made to insert the nails are small. These scars typically fade over time and can be managed with proper wound care, often becoming a minor cosmetic concern for patients. When can we remove the intramedullary nail? The intramedullary nails are typically removed about 12 to 18 months after surgery, once the bone is fully healed and the risk of complications is minimized. Nail removal is a straightforward procedure and allows the legs to return to their natural state.